We are at Foundations Integrated Medicine and Sports Health. I have to read it. That's a big name.
It
at
is a big
Muncie
name.
Chiropractic in Bristol. And I'm here with Samantha Fox. And
Yes.
You've got me hooked up to an IV.
I do.
And tell us what you're doing and why.
Okay. So we met Morgan last week doing our interview, and we talked about the IV vitamin infusions. He was really interested, so he decided to come back and get one today. And the one that he chose was our Get Up and Go. And we have these little brochures that you can get when you come into the office that's going to explain all of the infusions that you can get, and I go over them with you. The one that he's getting specifically is for a boost in metabolism and energy. So it contains a lot of your B vitamins and a lot of different vitamins that also help you metabolize your food as well.
So I've been at the doctor's office and I would hear somebody coming in. I'm here for my B12 shot. Mm-hmm. So is there B12 in this?
There is not B12 in that,
okay.
But I can add B12 to it here in the office. So that's something we usually talk about as well. It just depends on if they've had issues with B12 absorption in the past, or if they've had issues with anemia, things like that. So
you could be taking, like my wife and I take probably 6 or 8 vitamins a day.
Yep.
And if you don't know, they could just be going right through you and not absorbing.
They can. A lot of times they call it, it's expensive pee. And I excuse that term,
it's all right.
That's what it is.
I can think of worse.
That's what it is, because you're going to excrete all that out. So
how do you, is there a way of knowing if you can absorb?
A lot of times it'll be the color of the vitamin, or you can smell it very strong when you use the bathroom. And that's how you know if you're excreting them that way.
It's just going right through you.
Yes.
And I can taste vitamins in my mouth now. And
that is very typical. Almost everybody. We have a few who don't taste them, but 9 times out of 10, everybody says, I taste that vitamin.
So what kind of vitamins are going in me right now?
Right now we've got B1 and B3.
Okay.
B2, 5, and 6, glutamine, arginine, ornithine, lysine, citrulline, and carnitine in there. So, and I know those are big words
never heard
for
of
everybody.
Any past the B's, I've never heard of it.
But a lot of the vitamins for your metabolism are the ones that people have never heard of before.
So is there anybody that should not get this? I mean, is high blood pressure or other things a factor?
There are factors. So we want to make sure that there's no congestive heart failure. A lot of times with people who have congestive heart failure, they're on a fluid restriction anyway, on what they can even just drink in a day. So I'm not going to, what they call, overload somebody with congestive heart failure with more fluid. I also just want to make sure in general, just some general health as well. But really, as long as we keep tabs on if you are a frequent person who comes in and gets your infusions, we want to make sure that you're not getting too many vitamins. Right. So we'll do lab work. Just depends patient per patient. If you're coming back frequently, that's when we'll check. But if you come in once every 6 months and say, hey, I want this vitamin infusion, it's a little different. But we do stay cautious.
I've got a question. It might be a dumb question.
No.
But if I thought of it, there's got to be somebody else out there that's thinking about it.
I'm sure.
This is in a saline solution.
Yes, it is.
So saline is salt.
Yes.
So if you're on a low sodium diet, would this be bad for you?
Well, it depends. That is 0.9% sodium chloride. So it depends on...
So it's very low?
Yes.
So it's mainly water, a little bit of sodium, and then whatever goodies you put into it. Okay.
Yep. And also, if anyone was interested in just a saline infusion, you're dehydrated, you know that you can't get your water in that you need, and you're just feeling generally down, we could just do the saline. You don't have to do the vitamins.
All right. Well, on a normal day, I drink a lot of water. I try to get a gallon in.
Yeah.
So should I not after this, or I mean, will I flush everything out?
I would continue to do your normal water that you drink. Don't change anything your body is already used to.
Okay.
So you just keep drinking your normal water.
All right. So how long does this usually take?
45 minutes.
Okay.
Yep, and that's usually after I've gotten the needle in. So you can expect to be here an hour 15 minutes.
Okay.
Yeah.
And there's no pain involved. I mean, there's the little stick, which we're all used to when we go to the doctor's office. But other than that, I don't even know what's going in there.
Yeah.
Except for the taste.
Except for the taste.
And that's not offensive either.
No, and usually we carry peppermints here in the office for that. And then we turn the lights off. A lot of people like to recline and relax, lay with the blanket. Sometimes we'll play soft music. So it's kind of just relaxing as well as good for you. I
can be looking at my phone.
Yes, a lot of people look at their phone.
One-handed there. Yep. All right. Well, thank you so much. And we'll have more questions later. And we're going to take a little break. And while I'm being infused, we're going to talk to Dr. Muncie about some other things you offer.
Sure. Sounds great.
So, Morgan.
Yes, sir.
Tell me what you think about that IV. What are you feeling right now?
I feel nothing.
Isn't that wonderful?
That's good.
It's better than putting a whole bunch of pills in your mouth and trying to swallow them, isn't it?
The expense of them, and just the fact that you don't know if they're doing you any good or not.
Well, they usually aren't, because a lot of times when you take those vitamins, have you ever noticed going to the bathroom and it's all yellow when you urinate?
Yes, especially like a vitamin C or something.
That's because most of that's going out. And the other part of it is non-digestible fibers that are put in those vitamins, so you're really not digesting them. The ones that you do are further broken down by stomach acids and enzymes that are built up in your stomach. So you're really not absorbing as much as the vitamin as you could. By doing these infusions, that is going straight into your bloodstream. So we get an opportunity to get the vitamins into our bloodstream and absorb them readily and utilize them to the best of their abilities.
I know years ago my wife and I were taking the B12 under your tongue. Is that a better way of doing vitamins or not?
Well, that's a buccal way of doing it. That's a better than swallowing the vitamin, which is going to break it down. That's called the buccal membrane, and that actually allows you to absorb that vitamin into your bloodstream as well without going through the digestive process. So that's not a bad way of doing it. It's just that this is a better way of doing it.
You know it's getting there with this one.
Absolutely. You know it's getting into your bloodstream. At some point today, you might taste that.
I'm already tasting it.
So you
immediately.
You get to taste the B vitamins actually surging through your blood and getting into your around near your taste buds and in your mouth and in that buccal membrane that we talked about just a minute ago. So you will get that taste of the vitamins. Some people do, some people don't, though.
So if you get this, how often?
Well, it depends on you. It depends on what your body's requiring. Some people do them once a week just to have, a great influx of vitamins into their system to keep themselves healthy. Other people set up programs to do it every couple weeks. Some people want to do it once a month. So it really depends on your lifestyle and what you're putting out there. A more active person that's doing a lot of weightlifting or running or things like that might want to look at once a week. A person that's moderately active might look at every 2 weeks of doing something like this, and somebody that's not as active, we could do either way. I mean, we could go out to every 3 or 4 weeks and do once a month or something like that, or periodically, or they might require more vitamins and stuff because they want to do a diet.
So for a competitive runner, this wouldn't be something illegal to do before a run?
No, it wouldn't be, because the only thing in it is the vitamins that you're going to be taking with saline. So it's actually going to be helpful in that case. See, for a competitive runner, it's great to have this one and the recovery one. So do one before the race, a few days, and then do the recovery one after, so that their body can heal and repair. Because if you're a competitive runner, I promise you're breaking down the tissues and damaging the joints and things like that over time. So this is a great way to replenish those nutrients that you've put out and you're not getting back in your diet.
And you have a laundry list of different ones that you can do.
Absolutely.
So rather than take up too much time here, make an appointment with Dr. Muncie, come in. They can just come in and talk about it and find out about it, right?
Absolutely. We'll be glad to sit down and talk to anybody about it that wants to find out more about our vitamin infusions. It's a great way to stay healthy, and you don't have to keep handfuls of pills in your mouth.
Thanks a lot.
Thank you.
Okay, I'm almost done. So once you unplug me and I head home, anything I need to do? Drink water, don't drink water.
No, just continue
life
about
is
your
good.
normal day.
And I should feel better, if not today, in a day or two.
Yes, you should.
All right, since this is pepping me up, does anybody need to be worried about it interfering with their sleep?
I have not had anyone say that it interferes with their sleep. So if it does, it's just on the off chance that maybe you weren't really going to sleep that well anyway that night. So not because
don't blame it on Sam.
Don't blame it on me.
Alrighty, so as we said earlier, there's a whole laundry list of different infusions you can
Yes.
get. Give her a call and see which one's right for you. And if you see me running home instead of driving, you'll know this thing kicked in.